my name is Paul Root and I'm an orthopedic surgeon. I attended college at Augustana College in Sioux Falls, South Dakota, and I attended medical school at the University of Minnesota, Minneapolis. Including kindergarten, it was 26 years. Oh, we work with patients of all ages, anything from newborn babies with hip dislocations to, 90 or 100-year-old elderly patients with fractures. Where the bone is literally shattered and there's pieces missing and you can't put it back together anatomically. You just do your best to get as close as you can, and sometimes you have to bone graft it and do so. Probably really severe fractures may be the most difficult surgery that we do. Probably the most commonly seen injury, well, in your age range, it's probably wrist fractures, and probably second would be clavicle fractures or collarbone fractures. This is an X-ray of a normal hip here. This is X-rays of a knee. Here's some X-rays of a fairly crazy young girl that I know that injured herself, and most of the time when 12 and 13-year-olds break their bones, they don't break it that bad, and we're almost always going to treat it without surgery. But this young girl actually broke the bone so severely that they were out of place markedly and unstable, and one of my partners actually put plate and screws on. Here's an after photo, and you can see the holes in the bone are still there. These will fill in and normalize over time. Do we know who this is?
Jessica slammed her arm in the car door and she thinks it's broken. Can we see Dr. Root?
Are you sure you want to see Dr. Root and not Dr. Robertson or Betts or?
We're sure.
Okay, down the hallway and to the left.
Okay. What, Jessica?
Okay, Jessica has sustained a left wrist fracture. It's not displaced, it's not out of position, so all we have to do is immobilize her for about 4 to 5 weeks while it's healing. So we're going to put a short arm fiberglass cast on her arm. So the first thing we're going to do is we're going to put on, it's called tubular stockinette. It's basically like a stocking just to prevent damage to the skin. Thumb out there. We're going to put that like that. When we're putting a cast on here in the office, we have about 20 different colors to choose from.
Pink!
You want pink? Because I got multicolored. We just start wrapping this on like this. And that's pretty colorful. And you don't want to touch this for about 8 or 9 minutes while it's hardening. It's just water that's dripping on you, so that won't. Once I've got the cast wrapped on, we're not quite done. This is a fairly round cast right now, but if you look at your forearm, it's really not that round. So we give the cast some shape. It's called molding. You can kind of hear that it's still pretty sticky. That's it. Now we're going into the X-ray suite. This is where Jessica would get her X-rays. This is our X-ray machine. Looks like it's actually kind of put to bed for the night. So basically, we're going to have a plate that we put down, and then when you put the arm under that, and then the machine shoots X-ray beam through.
What is your job here?
I am an X-ray tech.
What is your favorite part of your job?
We're busy all the time. It's just people in here all day long.
Is Dr. Root enjoyable to work with?
We love Dr. Root.
Jessica's a very fast healer. She's healed her fracture now in about a half an hour. So we're going to take the cast off. We sometimes will put a little spacer underneath the cast as we're taking the cast off. This cast saw is intimidating for a lot of people because it's really noisy. It's actually, this blade does not spin, it vibrates. It just rocks through. So it'll sort of bounce off soft things like the skin and vibrate through the hard cast. And typically when a cast has been on for 3 to 4 to 5 to 6 weeks, you take the cast off and the skin looks pretty gnarly. It's all almost looks like alligator skin because each day as you're going through the day, you're knocking off dead skin and new skin cells are coming up. So you've got a cast on for 5-6 weeks, the dead skin just kind of collects and it looks kind of gross, but you can see she's got fine skin.
Mm.